My name is Jacinta and this is my Chapter 1 video on my community health project. Gizem and I are undertaking our project at Merry Community Health. Now to have a closer look at Merry Health. Merry Health are a non-for-profit community health provider, providing around 50 health services including those listed on the screen. They have 11 locations across northern Metro Melbourne, 8 being in the city of Moreland and 3 in the surrounding local government areas. Now looking at the organisational structure, Merry Health have around 350 staff members across all their sites. Now to look at the dietetics team of Merry Health. The dietetics team comprises of Annie and Julie. Annie works in the age and disability care team, mostly having older clients who are referred for weight loss or weight gain, whilst Julie works in the prevention and complex care team, and her clients are predominantly made up of fussy eating toddlers and children, those with lifestyle diseases, and those with mental health disorders and intellectual disabilities. Whilst our project is not within their role, it will help them provide an appropriate resource for their clients with mental illnesses. Now, to have a close look at our project. Our project is to create a healthy eating and mental health education brochure for the clients of Merry Health that have a mental illness. This will involve surveying these clients to identify what their felt needs are and using this information to help us produce a healthy eating brochure for this population group. Now to look at the background of the project and rationale. Dietitians receive many referrals and see many clients with mental illnesses. There is growing literature regarding healthy eating and its impact on mental illness risk prevention and treatment. Therefore, the dietitians of Merry Health would like to create a brochure specifically about healthy eating and mental health, as there are currently a lack of resources specifically for this. Now some stats to support our project. Findings from the 2014 Victorian Population Health Survey showed that Moreland City Council residents ate less servings of vegetables per day compared to the Victorian average, and they also reported a slightly lower sense of well-being compared to the Victorian average. Now for the goals and objectives of our program and the strategies of the project. Our goal is to assist in the reduction of lifestyle-related diseases of clients referred to dietetics at Merry Health with a mental illness. And our objective is to increase the intake of plant-based foods of clients referred to dietetics at Merry Health with a mental illness, from 6.7% to 7.4% for vegetables and from 51.2% to 53% for fruit by 2025. Our strategies to help meet our objectives are to contact other community health centres in Victoria for benchmarking on the healthy eating and mental health resources they have, to conduct a felt needs survey of Merry Health mental health clients on what impacts their ability to achieve healthy eating and what their current fruit and vegetable consumption is, and to create a healthy eating for mental health brochure for clients of Merry Health. Now, to look at the timeline of the activities we're going to complete across 5 weeks. Week 1 is going to focus on collecting the prevalence data of fruit and vegetable consumption and mental health, developing the felt needs survey, and benchmarking the other community health organisations for their healthy eating and mental health resource. The second week focuses on conducting the felt needs survey and interpreting results, and conducting literature review of healthy eating for mental health clients to collect information for the brochure. On week 3, we'll be starting to work on drafting the brochure, while week 4 we will be testing it out to mental health clients and refining it according to their feedback. And finally, week 5 will entail completing our project report and presenting our findings to Merry Health. Now on to what part of the program management cycle our project fits into. Our project fits into the needs assessment part of the program management cycle, as we're conducting a literature review on healthy eating for mental health, collecting population data on the prevalence of mental health conditions and plant-based food consumption, and also conducting the felt needs survey of Merry Health clients with a mental health illness. Our project also fits into the planning stage of the program management cycle, as we are designing and planning the project we're going to implement. The implementation phase would focus on the project methodology and timeline of what will occur, which was previously mentioned. The evaluation phase focuses on the process, impact and outcome evaluation of the project goals and objectives. While our project won't be covering this phase, we could consider how this project could be evaluated in the future, for example conducting questionnaire surveys on the usefulness of the brochure to determine project success, and conducting surveys to determine any changes in fruit and vegetable consumption of intake clients. Finally, in the dissemination phase, this would look at discussion and distribution of project results, limitations, recommendations, and future planning. Finally, onto the theories and frameworks that underpin our project. We're using the determinants of health. The determinant health theory supports part of our project, as our felt needs survey is looking at certain factors that impact healthy eating, which are listed on the screen. We're also looking at the client-centered care approach. These strategies will be applied when identifying community perspectives through surveys and tailoring the brochure to the audience for example, having a low literacy and highly pictorial. And finally, a stages of change model. Our brochure can fit into all stages of this model, specifically the pre-contemplation stage, as it outlines reasons and need for healthy eating and its benefits. Thank you.